committee will come to order at 1:08, and Councilor Don Garvin is going to do the invocation for us.
Father in heaven, the creator of all things, we thank you for this beautiful day. We thank you for the good April showers we've had. We ask now that you would bless each of us, and we pray that your will be done in this committee. Forgive us for our sins. In Jesus' name I pray. Amen.
Roll call, please.
Janelle Bullride.
Here.
Dick Lake.
Here.
Bill England.
Here.
Jack Baker.
Here.
Joe Bird.
Aye.
Julia Coates. Here. Jody Fishinghot. Meredith Fraley. Don Garvin.
Honey,
China Gloria Jordan. Frankie Hargis. Present. Chuck Hoskins Jr. Lee Keener.
Aye.
Curtis Snell.
Here.
David Thornton. David Walkenstick. Kara Callan Watt. Honey. We do have a form.
Next is the approval of the minutes for March the 12th.
so moved. Second.
Been seconded. All in favor? Aye. Minutes are approved. On reports, we have Claire Moore first, Mr. George Values.
There's a report that should be in your packet. I think the easiest way to do that would be to just entertain questions.
Do you have any questions? Yes.
Thank you.
Councilor Box.
Thank you, Madam Chair. What is the status of the MRI machines, engineering and such for installation?
We are now trying to whittle down the cost. The estimated cost on construction came in at 1.3 and 1.5 million. In order to keep the project completely here in the Oklahoma area, we have a $1 million threshold. So we have to get that cost down to below $1 million. The estimated cost is over $1 million. It has to go to agency at HHS, above IHS, to be approved, which, from what I'm told, adds years, not months, to the project. So we're in the process of going through and trying to cut costs on the project.
May I ask another question?
Yes.
Thank you, Madam Chair. So just to clarify, because I went back through our monthly reports for this committee and showed where the status of the MRI had been coming through the whole thing. But just to make sure my mind's clear, because you have to not only then secure the MRI machine, but then you have to get the budget approved for engineering and alter the facility for that room to accommodate the load and all the specs and the electrical for the MRI machine. Is that correct?
Yes.
And so that's a process out of your hands where you have to go to IHS area and hopefully not to HHS. Because that sounds like it'll even be longer.
That's correct. That's not, I'm just trying to comply with IHS standards.
And they won't even let you start that process until you've secured the MRI machine, probably, right? Or is it has to be in parallel or something similar where it adds time?
Yes, that's correct.
Okay. Thank you very much.
Councilor Keener.
Thank you, Madam Chair. I had a similar question and concerning the MRA, 65% complete the design.
Yes.
And then the emergency room redesign is complete.
No.
No, it's getting started.
It's started.
Okay. Will that be?
The MRI is first.
Will that? Okay. So it'd be like months apart, or?
Yes.
Okay. Okay. That's all I need to know. Thank you. Thank you, Madam Chair.
Any other questions? Okay, we thank you.
Thank you.
Next is Ms. Connie Davis, Cherokee Nation Health Services.
I'd be happy to entertain questions about the report from February.
Councilor Watts.
Thank you, Madam Chair. What's the status of the contract health services policy for the additional 5% dividend monies?
I believe I'm happy to report that we will begin to utilize those funds week. We had some question regarding, when you define, say 100%, there was an opportunity for us to be taken advantage of versus, you know, if a patient comes in and selects Gucci or a high brand frame or progressive tinted lenses, we wanted to make sure what the expectation was on behalf of the tribal council and what we could provide with that. So we're basically going to follow current practices, but just have more funds available for those services.
Because I had submitted a list of questions pertaining to the policy. I've gotten none of those answers back. So you're saying we have a completed policy, but I haven't gotten answers and I haven't seen the final, and I assume no one else has seen the final on the council.
I didn't, there's been no alteration to the policy. I just needed clarification on what does that mean. And I met with Chief Baker on Friday. I've met with Dr. Stilberg and Brett Hayes.
Okay, because the focus of my questions was around clarifying the policy so that if Cherokee A from Rogers County would be treated the same as Cherokee D from Delaware County or Cherokee County, whatever that, like, the different, we would have fairness and equity. So if we don't have a written policy, I mean, where do they go to say, I am being treated the same as all other Cherokees?
To their contract health provider, or to whoever's providing those services should be able to provide that service under this policy. I misunderstood that you wanted me to change the policy because I didn't feel like that was in my, I didn't feel like it would be appropriate for me to change something that the council had approved.
Well, that was the chief's policy, and we'd been provided a draft, the way I understood it, and we were giving comments back. And a lot of mine were asking for clarification, not necessarily to change, but to clarify in writing, so Cherokee over here knew that they were going to get the same access to those Cherokee dollars as a Cherokee here or over here. And I didn't feel like the draft policy we were given was clear enough, that it was not specific enough. It didn't talk about, for example, on the cost income requirements.
Mm-hmm.
I mean, I think you have that list of questions.
I do. I have them with me, as a matter of fact, and they were good questions, and those were things I needed to clarify. I mean, they were very good things, and we will follow the federal income guidelines for poverty level.
So was the wording on the policy changed to reflect that so it was clearer then?
No, but if that's what you'd like, we would certainly be able to do that.
That's what I was
Okay.
looking for.
Okay.
That it wasn't that I necessarily objected, but there wasn't enough information in the policy to even know.
Mhm.
And I think one of the questions too, and I can't recall because I don't have it in front of me, is that how is that relationship for like Claremore Indian Hospital, so Rogers County, Cherokee, Nowater, Craig, these other counties, Delaware County, Mays, the other ones affected. What is that relationship then? Are we gonna expect the IHS contract health service employees to then refer, and how do we secure that their money's spent first and then ours, but not trap our citizens in medical bankruptcy? How's that all gonna work?
Well, our plan is that once a referral is deferred or denied, because a lot of times they're deferred and they get caught in the system and care is delayed months waiting for funds, that a list will be provided to our contract health services, and it will be reviewed on a weekly basis. And then after we validate that they're a citizen, a Cherokee citizen, then those funds will be distributed appropriately.
Okay, so I have a number of people that have already contacted us. We've sent to the chief's office and stuff, and we've never heard anything back. Are those people going to be cared for?
We're going to begin that process this week. So I will have to be dependent on the reports, what we get in the report even this week.
Okay. All right. And then where are we at on the jurisdictional issue for Claremore Indian Hospital and assisting with that and compacting? Did you get an answer on possibly compacting the hospital?
I have not got an answer on that. There's discussion here and there, but no specific
Okay.
answer.
Thank you very much for your time. Thank you, Madam Chair.
Councilor Hostin.
Just following up on the councilor's questions. The act was passed several months ago, emergency clause, it went into effect immediately, but I understand it takes some time to get the rule in effect. But is it the case that if we identify folks that were denied at Claremore Indian Hospital after the act went into effect, but before your policy went into place, that those folks will be considered? In other words, they're already in line.
I think it would be very difficult to go retroactive. I believe the policy had a date of November on it, and I think it'd be very difficult to go back that far to recoup that.
And you may not have the answer to this question, but the question to the chief would be this: how can we reconcile the fact that we passed an act to give these funds to that purpose, and yet, because of the delay, which is understandable to develop a policy, that there's folks that are caught in the middle? I mean, there's folks that I've sent over to Contract Health, and I've even got feedback in which they've said, yeah, this sounds like those folks might fit in this new policy. Now, they didn't guarantee me that the policy was going to apply, but it does seem to me that if we've had folks that have met the need since the act was passed, they ought to be considered. Now, you may not be able to answer that right now, but it's something I'd like to take back to the chief.
No, I would agree we could consider it. I think the important thing is to quit hanging on to the money and to get it out and provide the services that are needed. And maybe we need to do a study of what's out there, because that's the unknown right now. We don't know how many referrals are not going paid, or how many patients' needs are being deferred or denied because of that.
I mean, I'd like to see us, if it's a request for information to Claremore Indian Hospital, I'd like us to ask from the date the act was passed to date, how many denials do we have, so we at least get an idea of what the universe is.
Okay.
So if you all work on that, that'd be great.
I'd be glad to.
Councilor Harkins.
Connie, something I brought up a couple months back about the vision insurance, those with vision insurance and being charged more than those without it. Are we working on changing that?
We are looking at that. What I'm learning is some of the contracts have gone for a number of years without being negotiated, and that's on my list of things to get done, because it is a ridiculous process if you have insurance. I mean, it's so convoluted, but we will be changing that.
Okay, all right, thank you.
Councilor Fisher.
Yeah, last month in committee, Councilor Lori Jordan requested an automatic appeal process begin with the submittal of a denial by Claremore to Contract Health of the Cherokee Nations. What have you worked on towards that?
The submittal, I'm sorry, I didn't
As soon
understand.
as they're denied, as soon as one of my people in Delaware County is denied, as soon as denial, right then, it's supposed to go to our Contract Health for this 5%. What has been worked on towards that?
Well, basically the work we did last week. We haven't worked as quickly as I'd hoped we could. We had our survey, and that took an entire week out of things. And we're hoping that now that process will help expedite the approval of those referrals.
So it'll be when the denial starts, as soon as they get the first denial?
Yes, yes,
Okay.
on a
Would you-
weekly basis. And our plan is, I guess I should have followed Ms. Watts as well, we want to provide the council with a report during this time, or with a routine report of the people who have been approved through our Contract Health with this specific money, so that you're assured that your citizens are being taken care of.
Appreciate that, thank you.
Okay, my second question is, I have gotten a lot of calls and I have done a lot of emailing on one of your employees that is working, not at this complex, at another complex. They're being signed off in health, they're going to law school, they're also making about a $70,000 a year paycheck. What have we done with it?
That is under a very thorough investigation.
Are you the AG, the marshals?
The
Because I
AG
remember the AGs at Oklahoma at one time prosecuted a bunch of ghost employees. The Oklahoma Attorney General did in the health department. And I'm taking it this person might possibly be a ghost employee, because I don't see how I would like to know more about who's signing off on her time card, where she's stationed, how we can go to law school at the same time being getting $70,000 a year. And evidently this has been going on for 3 years. And I want to know who approved this.
Well, all I can legally tell you right now is this is under a very thorough investigation by our AG office and the Marshal Service.
Okay.
And that should be resolved within the next 30 days,
Is he
if not
involved
sooner.
in any of this too? Because it's my understanding that there was the ones that was paying for part of the tuition too.
I don't know that.
Okay.
I don't know
Find
that.
out and I'll ask
Okay.
questions at CNB. Okay,
I
thank you.
sure will.
Yeah, just follow up on something that Councilor Fishing mentioned. So reports will come from Claremore IHS to our Contract Health saying who's been denied. It won't just say who's appealed a denial.
No, it's all the deferrals and the denials.
Deferrals and denial. So it's not necessary for one of our folks to appeal before they can qualify for these funds. Is that
No,
correct?
sir.
Okay, that's good, and I appreciate hearing that, because there was some concern on mine about whether there'd be some folks that would just fall through the cracks because they simply wouldn't appeal, et cetera. So I appreciate that.
Next is Speaker Tom Glory Jordan.
Thank you, Madam Chair. Connie, as I understand it, on the policy that was sent over from the chief's office, the dentures and eyeglasses are available to all folks in the 14 counties from this money.
Yes,
And the rest of the money is going to be provided for the Claremore denials or deferrals, is that correct?
yes. As a matter of fact, I have a copy of that policy if you guys would like it for reference right now.
Yeah. So there will be none of that money available for denials of any contract health down in this area, is that?
No,
At this time, that's the way the policy is set up.
that is correct.
And that's approximately a little over $3 million that will go directly to denials and deferrals from,
Actually, the information I have is the current balance is 4.3 million.
okay.
So we have a lot of money out there to take care of a lot of unmet need.
I would encourage you to look back at our date that we first passed this, at least back to that date, so that we can pick up people that have been waiting in the hopes that they were going to be able to tap into these funds.
Okay.
Actually, those were the people that brought this to our attention, and I hate to see them not be allowed in this pot when they're the very ones that we heard their voices and got this passed on their behalf.
Okay.
I know that's going to cause additional work for your department, but that seems like the only fair thing to do is to go back at least that far and provide those people a mechanism by which they can get in and get help for their contract health needs also.
I think it's something we can consider, and I think the important thing is how much are we looking at?
And if it is a matter of this body passing a resolution to that effect, if we need to do so, let us know by the next meeting, because I have a feeling that there's a good majority in here that will want us to go back that far. And so I'm encouraging you to do that on a voluntary basis, rather than us having to get involved in any further into your work.
Okay.
But I really think I'm hearing from a good portion of this council over the past couple of months that they expected that those people would be part of the group that was going to be able to take advantage of this.
Okay.
It's not really their fault that we took this length of time to get this thing rolling. And so I don't think we need to take a vote, but if we do need a resolution, I will put that on the agenda for next month, unless you think that you can go ahead and take care of it through your department.
I think we can take care of it.
Then I will hold off on that and see if you're able to do that,
Be
okay?
happy to.
All right, thank you.
Councilor Lay, you are next.
Thank you. The report that will come from Claremore Hospital to us, or do we obtain, have y'all talked with the Claremore Hospital as your?
We've briefly talked, and we're going to meet in the next week, Mr. Valier and our contract health and his contract health, and I will send an email of what the conclusion of that meeting will be and how we will communicate that information to the tribal council.
And so if we're wanting to go back to, I think, this report said November, I guess we'll have to bring that information forward to y'all, to our contract health, is that correct?
Yes.
Does it look like everything's going to work as far as these reports that you're going to need from Claremore? Do you see any problems with it?
I don't know why it wouldn't.
Are we able to get them now?
Well, my answer stands as we spoke the other night. Depends on who you talk to, but after this week, I can assure you it'll be resolved.
Okay, thank you.
Councilor Watts, you're next.
Thank you, Madam Chair. On the contract health service monies out of CHS, the only concern I have is the possibility of collecting some of those funds from IHS where it would be captured in an appeals process.
Mhm.
So are we also going to try to figure out possibly how to appeal and recoup those costs as well?
Yes, that's something that needs to be considered as well, because it's not uncommon for, us to be able to capture $20,000 in healthcare charges and recoup those funds from IHS. So we don't want to leave that money on the table in area office if we have the opportunity to bring it back into our funds.
Okay, very good. So I just wanted acknowledgement that you're looking at that.
Yes.
Perfect. Thank
Yes,
you.
ma'am.
Thank you, Madam Chair.
Counselor Keener?
Thank you, Madam Chair. That was a question I was going to ask as well, but I got some more. I just want to make sure that in your policy, letter A, that 20% will be on dental care for anyone in the 14 counties?
Yes.
And same with B, 20% for optometry, anyone in the 14 county area?
Yes.
And then the 60% is described well in the 3 pullouts there. So do you see any problem with that, as far, especially on the appeals, with they get timely health care?
It's going to be a challenge. I'm not going to stand here and tell you it won't be, but we'll just have to do the best we can.
Okay. And so that would not apply to the ones within the Cherokee delivery area, just the ones outside?
Yes,
right,
sir.
to go through all the steps?
Yes, sir.
Okay. Okay. So how about if they're in the Cherokee delivery area and they're turned down? Do they follow the same procedure?
They currently follow the same procedure. They would have to be deferred and then go through the appeals process.
Okay.
The same as they do now.
Okay. Thank you. Thank you, Madam Chair.
Thank you. Do you have any other comments or questions? Counselor Snell?
Yes, I have a question about how contract health is approved. I had a constituent who got an approval letter. He went and had his work done and everything. Then he gets a bill and his contract health was denied. Although he had his approval letter, here's what's approved. Well, that letter should never be, an approval letter should never be sent out. So what can we do to correct those type of mistakes?
That's going to be a big endeavor, and without knowing the specific situation, it's going to be difficult for me to provide you an answer. But a lot of times, facilities that we have contracts with insist on sending a bill to the patient because they could be in a legal, they could be in jeopardy legally by not sending a bill. So it depends on how we need to do a better job on our contract, how we establish our contracts. And Dr. Nolan has been working with some people, and I think we're going to make some changes in contract health that will expedite the referral process. I spoke with Ms. Fulbright before this meeting. It's too much trouble for patients to have to go back repeatedly to get referrals for ongoing services for coverage that services we don't provide here. So we want to streamline that process as much as we can and make it more convenient for the patient. So if we could get together and maybe I could get that information on your constituent that had the problem, I could provide you a better answer.
I've sent it in to Mr. Hayes.
Okay.
He has information.
I'll check with him.
Counselor Keener?
You have one more question, please. Thank you. And we're good to go. We're good to go with this policy. It's not going to change from this point forward.
I'm not changing anything.
Okay.
But we're going to start using that money this week.
Okay. Thank you. Thank you, Madam Chair.
Okay. Oh, Counselor Knight?
Thank you, Madam Chair. On page 2, number 3, I hate to go over this and belabor it, but all of us on the north end are concerned about this piece of legislation and this policy guide, as you know. And it says these patients must first exhaust all appeals. You're not going to make them go through a denial and an appeal before we help them?
I believe that, I'm sorry, go ahead.
Well, I'm just not understanding the fine print here.
I think we want to make sure, first of all, that they don't, in fact, have insurance or a third-party provider. A lot of times, they already have Medicare or insurance, and if they have those funds available, then we should utilize those resources.
Well, I agree, but I'm not, the way I read this, it's an appeal from the IHS area and not Medicare. If I'm wrong in reading it, then I apologize.
My interpretation of that is that once they go to their contract health services and it's denied, and then we've got the process within our system now that how we're going to take care of that.
We'll pick it up.
Because like I said, deferrals sometimes go to the end of the budget year. And if you know, for example, if we had a referral today for something, it may be put off till potentially October, waiting for more resources to come in, if we're in your area.
When you say service provider, does that mean Medicare? Is that what?
That's my interpretation.
Okay. Thank you, Madam Chair.
Councilor Lott?
Thank you, Madam Chair. Just to make sure, the way I understand it is, once they've been deferred or denied by, for example, Claremore Indian Hospital Contract Health Service, or Creek Nation Contract Health Service, or Miami, and they're in the jurisdiction of the Cherokee Nation and a Cherokee Nation citizen, that our contract health service money through the 60% of the 5% dividend would kick in, but we are acknowledging that we have the right to collect from those other third parties before we will pay out of our dollars, even though we're going to cover the remainder.
Yes.
Okay, thank you.
Yes.
Thank you, Madam Chair.
Okay. Any other questions, comments? Thank you very much.
Thank you.
Next is our old business. We have a resolution authorizing the funding of Cherokee Nation Home Health Services life care program for the amount of $250,000. And that was sponsored by myself and Councilor Fraley and Councilor Thornton.
Madam Chair, I move for approval.
Do we have a
Second.
Do we have any discussion?
I had some questions.
Okay.
So, am I reading this correctly, that this is a new program?
Yes, ma'am.
Okay, so we're gonna sustain this going forward at $250,000 is what we need to commit budget-wise? How's this gonna work? Like,
Basically, we identified a need, an unmet need of a lot of patients who have a third-party vendor that's insufficient to keep them safe in the home. And so what we wanted to do was propose, perhaps the word pilot's not on here, but a program that would look at that, let us really formalize it, and we would only take referrals only from our health system.
from Cherokee Nation Health System?
Correct. That would be the only place we could take these patients from.
How will you determine, you're gonna look at income and stuff then, and those things, right? Or,
Of course, we would, just like your, work similar to the contract health. We'd identify all payer sources in addition to try to secure other payer sources before these dollars were touched.
okay, and then how many people do we think it'll serve at this point for just this 250,000?
Based on our historical data, approximately 175 to 250, just depends on the case mix. And how much we can secure from other payer sources.
What's your deadline for coming back to us for reevaluating, like evaluating what happened under this pilot year?
I believe I outlined here, I'd like to come back in at least quarterly if the committee would like to hear that, and bring the information in quarterly as we go through the program.
Okay, and we have a pot of money found for the 250,000? See by who's our sponsors? Do we have a pot of money? The 250, is it, because we can't manufacture money, where's the 250,000 coming from?
Yes, good question.
I'm sorry.
Where's the
Where-
money
I'm
coming
making
from?
notes on what
Yeah.
you said.
Where's the
Looking for
250
a
coming
roundup.
from? Do we have a fund designated, or
Council travel or what?
is it Joe Bird's
Where's our
travel for the year?
Where's our financial?
I wouldn't think about that. Employee county. I'm not the sponsor. Where is the
That
money
come from our
coming from?
healthcare funds. The only place I know we could legally get it, unless we transfer from something else, and we have to be careful when we do that.
Are you recommend, may I, Madam Chair, if you don't?
You betcha I recommend it.
Okay. Are you
This is
specific?
taking care of people who have unmet needs that don't qualify for any other program. And I know personally people that this has really helped, and it's a very well organized program.
So you recommend it come out of the general fund monies for healthcare, or where's it?
Where we can find it.
So we're just asking Doug, where is Doug Evans? Do we have our CPA with us today? Okay, so before the next executive and finance, we're asking him to figure out where that money is in health.
Absolutely.
Okay, thank you.
Council Hoskins?
I note that we tabled this last time to give the executive director an opportunity to review the possibility of placing this under her department, if I'm reading this right. I guess, Ms. Davis, that would be your department is what I think they're talking about. Have you had the opportunity to, would you mind coming forward? Has your department had the opportunity to review this and whether it's feasible to take this function over? I think that was why it was tabled, and I don't know if that was direction that you were given, but that's, I think, what the curiosity was of the body last month.
This is something we are considering, yes, and we have a group coming in this next week, as a matter of fact, Thursday, to give recommendations on how to properly organize health. And we had some recommendations from our survey, so we're hoping to use that as an opportunity to implement best practices as modeled by nationwide hospitals and health delivery systems to our own.
Would you agree that it's premature then to pass this if you are all poised to do a reorganization and part of that, or at least a review of the organization, and part of that review is going to determine whether you want to do this? So I hate to consider this and possibly pass it when you all are on the verge of considering doing this at least. What's your...
I'm open to home health and hospice and these services coming under health. It makes sense. It provides a great service to our community. You know, I've been in home health in my career for 7 years, and Cherokee Nation has a great reputation in both the home health and hospice service delivery. They do some things that other organizations don't do. And so, you know, I would hate to compromise the ability to deliver that service to our patients. And I've had one brief meeting with Mr. Richards. I showed up at a board meeting last week, as a matter of fact, just unexpectedly. So I would like to spend more time with him. We've discussed some options to help better understand why we're here, having to ask for money in what is traditionally a for-profit business. And I think after he gets some more information to some of you guys, you may feel a little better about the decision.
I mean, I personally think it's a service we ought to try to provide if we can. The need is there, and so in fact, I would bet you the whole council feels the same way. It's a question of whether we ought to approve this now for Cherokee Nation Home Health Services Incorporated when our own health group is considering doing this. And so my feeling is we just need to table this for another month to give you more time to review it, because it sounds like you've had one meeting. And so that's what I would be inclined to do. So with that I move to table.
We have a second to table. Oh, Councilor Byrd, you were next.
I was going to comment, I totally agree. If the health department is still doing their own assessment with this, then I think also this would be premature. So I support Councilor Hoskins' motion to table.
Yes, as far as funding, I think right now in the general fund, we got $700,000 to $800,000. In another month, we should have $4 million. So I think that y'all do need to really go over and see what's going on and see if we can help these people. I'm like my cohort here, Mr. Hoskins, everybody I think wants to help. And, you know, it's not any of us right here, I guess, have ever been told that you're going to die. So you better get you some hospitals and try to help you through it. Now, I've been told I was going to die, but I didn't. So we're, you know, when you're in that boat, there's a lot of things running through your mind, and there's a lot of poor families out there that need help. And they're not getting it. And this is the only way that they're going to get it. Because they can't go to the state won't help them, and the nation didn't help. So somebody needs to help. If it costs $250,000 for a program, I think we ought to come up and pay it. I think we've got other programs in this nation that probably we need to look at, see if they actually need to be in the process of receiving funding every year.
And that's what we had.
We'll have to find that out in September.
We had communicated as a reporting system so that you know the patients who are receiving these funds, that you have that assurance.
Mr. Richards, a few council meetings ago, you didn't know what the objectives were, or if it's going to be profit or non-profit business that you're running. Have you got any clarity on what that is?
Well, since most recent meetings, we took the position that we're moving toward profit, and we've done away with a lot of non-funded and underfunded patients. And as of March 31st, we reduced our salaries by an excess of $220,000, in addition to other cost-cutting measures. So we are changing our service model.
And do you think with you doing that, that'll be the last time that you guys come requesting additional funds for the program?
Well, again, the funds for these are for people who don't have any services at all. So I'm asking for funds for those folks.
Is this a new program?
Yes, it is. It's a new idea.
And so this is different from last month?
This was on the agenda. We just didn't discuss it in this detail.
Okay. That's all. Thank you.
The concept, Rick, is a good idea. I think being under your programs is not a good idea. And if I'm going to vote for this, which I want to vote for this, it's going to have to be under health. I'm not going to vote for it to be under your program. You've come to us time and time again for money. And I'm sorry, Rick, I'm done. I think we had even discussed it before this meeting that I believe Councilor Byrd, you said he came to you all in 1996 and needed money. You needed money every time we turn around for what should be a profit-making venture. This is a good idea, but this idea needs to be under our health department. It does not need to be under your program. You need to get your program straightened up. You don't need to be adding something new to your plate when you can't get your plate in a profit-making venture, which is what you were set up for. Now, everybody's sitting here and nobody wanted to say that, but I believe that a majority of the council feels that you don't need anything else on your plate. I'm wondering why you have 1 foot in home health and 1 foot in PACE. Those are both full-time jobs. I don't think you need to be in both of those.
They are full-time
And
jobs.
Rick, you and I are friends, but this is business, and you've not run your business very well, and you should not be rewarded with a new program. Connie, if you want to take this up under health, then I'll be all for it. because we do have unmet needs here. And I would tell the sponsors this. I would be all for this because we have unmet needs. But it's going to have to be under someone other than yourself. You need to get your house in order with what you already got on your plate. Now, that's just the way I feel about it. I don't know how the rest of you feel, but I think there's several of you in the room that feel the same way. And we just need to be blunt with you. We're not happy that your program can't make money when it's for profit, and it's been going on since the 90s, and it's never made money. You're going to have to do some hard things to turn your own program around, and you don't need a new program to add to what you're already trying to work on. So if you're going to bring this back next month, if we're going to table this, bring it back, Connie, with the idea that the health department's going to run it, because I just don't see putting a lot of money into it unless someone else is going to run it.
I'd be happy to help however I can, because Medicare has restricted, there's not a lot of, the restrictions for home health services and hospice have just gotten tighter and tighter, and we don't know how to predict the future with the changes, you know, in the White House, you know, how it's really going to impact what programs get cut. So that's something, I haven't had the opportunity to review this, but we probably do need to be prepared to have an idea of how to take care of those who don't have resources for home health and hospice issues.
And this group is not going to be helped by the White House in election year while they're just trying to get themselves reelected. We're going to have to take care of our own people, but it needs to be taken care of under the health department. And Rick, you need to get your house in order on your other programs. If you can't show a profit, then we need to be looking at those programs going somewhere else too. Because that's what you're set up as.
Councilor Frey.
I was just trying, and I think she said it pretty well, determine what the objection is. Do you want this run as a for-profit or a non-profit organization? I'm not.
Is this directed towards me?
Anybody.
This program would never be a for-profit because there's no money to tap into. This is just an unmet need of people that can't get services anywhere else. We need to help them, but they need to be helped through our health department and not necessarily put on Rick's plate.
Another question, how is this going to impact your program, your health care program?
I will have to just study what this is because I have not seen his proposal yet.
Your plate is full too.
My plate is full, but it will, you know, it's something, it's health, and it's something that we'll have to address.
Will you have to hire additional people in order to run this program?
I don't have any idea.
Okay.
I really don't.
Okay, that's all.
Councilor Hoskin made a motion to table. It was seconded by Councilor Walkenstein. So we've had plenty of discussion, so all in favor of tabling for next month? Aye.
Aye.
Those opposed?
Aye.
Aye.
We have two of you opposed to?
No, I was,
Well, just let me get this straight here. Councilor Anglin, are you opposing?
Yes, ma'am.
Okay. Just make sure.
Madam Chair,
Yes.
it was a voice vote, so nothing should be recorded.
Yes, one comment from Councilor.
You said next week that they're doing a feasibility study for, they're coming in to get strategies on improving healthcare at IHS, is that correct? At your hospital?
No, well, the accreditation survey for the clinics and the hospital happened last week before last.
Oh, they've already happened?
Yeah, the survey happened, but we have a special group coming in
Yes, I'm
to
talking.
propose that on Thursday morning.
Okay, and you guys are gonna talk about this?
We can throw
program?
home health in for consideration as well.
Okay, could you guys report on that next month,
Be happy to.
on what they say and what their feedback is? on
Yes.
that? All right, thanks.
Yes.
Councilor Fisher-Hall?
I got a follow-up question on what I talked to you earlier about the employee. Would you please check into it? Because I was told that we're paying her tuition, paying the job, and she's not Cherokee, she's Seminole. And I want that to be very clear
Tuition?
cut. She is Seminole, she's an enrolled member of Seminole Tribe, she's not Cherokee.
Okay.
And I want that cleared up.
Okay.
That question. Thank you.
Connie, you have two more in Oklahoma City that you got the same problem with.
We're investigating
Go
those as well.
Look at all of them, okay?
Yes, ma'am.
All right, thank you.
Rick, I was just wondering, is it, I heard, someone made the statement that your department does not have a 401K, is that true?
That's correct.
And why is that?
The utilization was so low that our administrative costs were higher than what was being invested into the program, and so we decided to terminate the program. Just no participation, almost none.
Okay, any other questions?
Madam Chair? Over the last few weeks, we've kind of whittled around the edges pretty good here at what home health is and what it's supposed to be. I would like an opportunity to kind of come in and maybe actually take a few minutes and give the council a good overview and history of the home health, and maybe include elder care in that also at the next meeting,
I'd like to be on the agenda for next month
for at least a 10 or 15-minute presentation.
Rick, when you give that presentation next month, you need to tell us how PACE is receiving money from Cherokee Health Partners, and so that we get a whole idea of whether PACE is ever broke even. We were told at 45 patients that it would break even. And you're exceeding 100 now, and you're still having to take money from Cherokee Health Partners to operate. So we need to know truly,
And that's what I want to give you.
is it ever going to break even?
I want to give you a good total
Okay.
package
So if
of
you
the
would
history, and
give
I'll
it
include
to us
that.
in that context, I would appreciate it.
Just for informational purposes, I don't believe they've taken any funds from Health Partners for 2 years. So I'll get that for you too.
And you might also identify, I know we have a mortgage on your property out there, just where you are as far as the payment on that, and how all that works too.
Yeah, we'll dig into the things we haven't been able to talk about. Appreciate it.
Thank you.
Thanks, Rick.
We have new business, none pending. Do we have any announcements? No announcements. Chair will entertain a motion to adjourn.
You did good, Madam Chair. Thank you very much.
Next meeting is, all in favor of adjournment? Aye. Next meeting is May 14th.